Thank you, Mr. Chair. It's lovely to be back here at the glorious OGGO. Yes, so I am a regular member of the Health Committee, and so I have had an opportunity to sit through the multitude of meetings that we have had looking at the opioid epidemic. But what we have here in the motion from my colleague Garnet Genuis is actually substantially different than what we've been studying at the Health Committee. And this is about looking at the contracts and trying to get to the bottom of where the money came from. And this is precisely why I believe that it is critical that we have it at OGGO rather than at the Health Committee, because this is about looking at this. And I understand a few hours ago that the chair and everyone on this committee did receive a letter from a doctor, and his name is Dr. Julian Summers, and he's a distinguished professor who has been quite vocal when it comes to addiction medicine. And in his letter, he talks about the fact that he is a clinician and researcher in the field of addiction, and he has led a number of different federally funded initiatives specifically designed to reduce addictions and related harms. And so when he saw that our motion was on record at the OGGO committee, he took it upon himself to write in to ask to present. And earlier this week, he actually was part of he did a podcast. And in the podcast, he was talking at one point during the podcast about some of the very concerning pieces that were coming out of British Columbia, specifically related to some of the top public health officers that were the ones that were making decisions as to whether we would have, whether they would go forward with so-called safe supply in British Columbia, that created companies that then stood to profit and are providing safe supply in British Columbia. And so effectively the very same doctors that were making the policy decisions as to whether they should or shouldn't go forward with a particular policy were in turn had companies involved to do this. And so I really do think it is critical upon us that we not only go forward with this study from my colleague, but have Dr. Summers come testify to committee to give a little bit more breadth of the allegations he made in the podcast from earlier this week. So I guess I'm going to see if perhaps we could have some conversation about first having a vote on the notice of motion from MP Genuis to get to the bottom of it, look at the contracts. This truly is the best committee when it comes to looking at the specifics and the dollars and cents of it, because we do know that this is government money that has gone towards these programs. We do know, and perhaps Liberal members can raise their eyebrows and everything else, but we do know that the program that was called Safe Supply is effectively governments that have decided to give prescription hydromorphone and Dilaudid. Specifically, in many cases, it is Dilaudid, which is the Purdue brand name of hydromorphone, which is a synthetic opiate that is the equivalent to being stronger than heroin, to people that are struggling with addiction, and that is all paid for by taxpayers. And we need to know who's paying, how much is being paid, and who is getting rich off of this.
Yep, exactly.
Because at the end of the day,
which liberal insider?
If someone is in fact profiting off of this, that is absolutely an issue. And if it's not happening, there shouldn't be any fear from any member around this table about getting to the bottom of this. So with that, I would hope that we can get to a vote.
She's great. She's really good.
Mr. Genuis, please.
Thank you, Chair. So I've listened to some of the debate, and I have a simple amendment to propose, which will hopefully resolve some of the concerns, and I had sent it to the clerk a few minutes ago. So the one change is in Part B, replace order with respectfully ask, because I think there had been some feedback on that around just provincial governments and So that's the one proposed change as part of the amendment. And then to add a Part C that says share the documents referred to in A and B with HESA in the event that HESA finds these documents useful. This is a document production request. It's not a study request. So I don't think there's a great need to have a lengthy back and forth about should this be at this committee or should this be at that committee. This is simply a request for documents. So how about we get the documents? We have the documents. We also share them with HESA. That way we have the documents and HESA has the documents. I agree with my colleagues about the proper mandate of this committee around contracts. At a minimum, based on that, we can agree that it's good for us to have them. Now, might members of the Health Committee find these documents interesting as well? Sure. So let's, I think,
is work
hopefully
getting done right here.
Adding that section in to say, let's request the documents. Let's not make the process needlessly bureaucratic by referring it to another committee to then request the documents you could then share back with. Let's get it done here. But yeah, let's share the documents with the other committee. So the amendment is to change order to respectfully ask in Part B, and to add in C, share the documents referred
Point
to
of order.
B with HESA.
Point of order, Chair.
Documents useful. So I'm suggesting that
Point
one of
of
my
order,
colleagues
Chair.
might want to move this amendment. Maybe if Ms. Goodridge. So yes, that's what I meant to say, Chair. I meant to say that I was describing
I think
an
I still
idea
want
for an amendment that someone else might move.
Yeah. Mr. D'Souza, go ahead in your point of order.
I think
Mr.
if
Taylor,
I understood
or
the
Mr.
amendment that
Bachrach
he's
is-
now
please
asking
let me
for us-
finish, sir. Sorry. Yourself on the point of order, then we're going to Mr. Bachrach on the speaking list. Go ahead, Mr. Souza, please.
Yeah, I think the amendment really should be read to move this to a HESA. I think is really what the amendment should be.
It's not a point of order, but